So just got done with an unbelievably busy clinic today. Just got back home, and my entire ride home today, I've been super frustrated thinking about this following concept. I am almost, even though I've seen it happen in slow motion, it's almost shocking how much more difficult it is for patients to navigate the system of medical care today compared to when I started in 2006 here in the Twin Cities of Minnesota. So let me tell you about my clinic today and how frustrating it is. So first of all, I had 3 or 4 patients that had ridiculous denials for surgery. I have these every single clinic. I always have people that come in. Obviously, they're crying. They're very upset. They don't know what's going on. So we sit there looking at what denial reasons were given to them by insurance. Most of the time, it's absolutely bogus. They've literally jumped through so many hoops. These are not people that just came in the first time. Many of them have been waiting now for a month or two, have gone through all the check boxes that the insurance companies that are practicing medicine are telling them to do, and then they get denied anyway, and they always find some reason. Mostly they're AI programs, because it's not so much real people anymore doing these denials. So that's one thing. Then there are the people that are coming in, and some are coming in from very distant locations. So I have a lot of patients that come in from the Dakotas, some from Montana. Just had a patient the other day that is going to be scheduling surgery that came in from Alabama. So they're coming from everywhere. And it's very interesting because some of these patients are in a ton of pain and they wait a long time to see me. So then they come in, and most of the time I can't even get them in for very simple things like a cortisone shot or something like that, because now most of the insurance companies are requiring pre-authorization. So it's not good enough for a board-certified orthopedic surgeon who's been in practice for 20 years, because obviously I don't have enough knowledge to make a decision on when people can benefit from a cortisone shot. So we've got to make sure that the insurance companies are checking and making sure that I'm not doing anything that I shouldn't be doing. I really, really appreciate that. And then there are the patients that come in and see me. And again, some of them have waited a long time, and we made a plan. We said, hey, you need to do X, Y, and Z, and then we can, evaluate this further and get you on the right path, whether it's conservative or operative or whatever it might be. I can't even tell you how many patients have not even been able to get through those hoops because of how onerous it is to do it. There's always something going on that is blocking them. And so, for example, if I send somebody for a diagnostic injection and they haven't been able to get it, or they were denied for it, then when they come back and see me, guess what? I still don't have the diagnosis. That's why I sent them for the diagnostic injection. So that's one other thing. And then one, final thing is that as far as specialists are concerned, I try to do very comprehensive evaluations and make sure that we look at patients 360. And there are many patients that need higher level specialty care. Well, guess what? Getting into a neurologist or an endocrinologist, or, getting in for certain types of diagnostic testing is so difficult. Why? Because I, even as a physician making phone calls, can hardly get them in a time frame that I feel is reasonable when people are really hurting. These are people that are missing work. They're people that they just can't get back to their lives. And most of all, they're suffering. And I've been in practice for 20 years. I have a very good sense of how to help them, but yet it just is so slowed down. Delays in care lead to poorer outcomes. Why? They're missing work, they're taking pain medicines, they're doing this, they're doing that, and none of it's good. So bottom line is, compared to when I started, when we can just get people in right away for things, we can schedule them for surgery right away, we can get MRIs right away, it's become an absolute bureaucratic nightmare. We're going to keep fighting. We have a huge staff. We keep adding to our staff so we can do this. But I will tell you, if you guys don't fight back, it's only going to get worse. You need to fight back against this nonsense because it's hurting you. We need to hear your voices. And that goes, yes, for you doctors too. We need to hear your voices. We'll see you on the next video.